There's a formula that I worked on, and it's always figure out what I want. I'm going to work really hard. I'm going to get it. I'm going to see results. The one thing that you really want, that everyone says is the most important thing in life, completely out of your control. Even if you think you're controlling it and doing all you can with IVF and taking the drugs, and even if you do that all to a T, it's still a big question mark. Every morning you go, it's 7 o'clock, you get blood work done. My arms were so bruised up after a while because there are only so many areas they can poke at you. And then you do an internal ultrasound. So you kind of just sit there in a lineup of women in a gown, waiting for your turn to get poked and to get prodded. And on top of that, you're taking drug after drug after drug. I definitely pulled back from some events because a lot of my friends were having young kids at that point, and a lot of friends were finding out they were pregnant. I went to one friend's baby shower where I was sitting with a bunch of new moms and one who was expecting, and I caught myself tearing up. I went to the washroom and just cried and then came back. So I couldn't put myself through that.
We were actually very fortunate because we decided to put our last 2 embryos in at once. So we went for broke, so to speak. And luckily one of them took.
But it was something that I didn't think was actually gonna happen, so.
Are you having fun?
And there he is, the product of so much blood, sweat, tears, the trying. That is Josh. Melanie Ng is with us in audience right now. Give her a lot of love. And Dr. Marjorie Dixon joins us as well. So, we know you are a fertility, an infertility specialist. We know what you've been through, Melanie. For those of us that live in this side of the country, we've seen you, we've seen your journey. But a lot of us did not know what you were going through. As a reporter, being out there covering these stories and knowing you have this huge personal battle going on, how tough was it for you to go through this in the public eye without the public eye knowing?
So that's the thing, right? Well, anyone who's going through the battle deals with it with yourself, with your spouse, with your friends, with your family, and then you have a whole other dimension where you have to put on a face. And I remember hearing results, no, you're not pregnant, no, you're not pregnant, minutes before going on air. And so you wipe away the tears, and I'm getting emotional now, and you get back on air, you smile, you see the red light, and you keep going. So it was difficult, and watching back that tape, I cry watching it because the feelings are still raw, they're still very fresh. Yeah. You watch back the tape and you know what you're going through, and you know what's going through your mind, even though no one else did. Exactly, and that's the thing, is that so many people go through it, and Marjorie can go through the stats that you think that you're alone. Even though you know a lot of people are going through it, there's sometimes no one can say the right thing to you. You feel like you're battling yourself. How prevalent is infertility? How many people are going through this struggle?
It's very prevalent, and it's actually doubled since the 80s. So it's 1 in 6 couples, or 15 to 16% of couples who are not using contraception and having unprotected intercourse in an appropriate fashion, so when they're ovulating, don't conceive. And it is something that people take for granted when it happens. And if it doesn't happen, I think, unfortunately, we take it upon ourselves as women. We blame ourselves. I must be doing something wrong. We're this generation of, if something is up, we go to a reliable search engine, or we do the research ourselves. We're very goal-oriented. I'll do this, and then I'll have a positive outcome. And that's not what fertility is. And it's so disarming for people to not be in control. And even when you go see a physician, with all of the fancy that we can do, there are limitations. There's only so many answers you can give, There are only so many answers that we can give. And it's tough on the patients. It's tough on their couple. It's tough on their family. It's tough on every interaction that they have. So it's not just the interactions that they have as a couple, but they walk down the street, you see a baby carriage, and you hear in groups, I'm happy for them, but I'm not really. That's exactly it. And Trace, I would avoid going to baby showers. I sort of held back on some friendships when I knew they were having kids. And like you said, I would see a pregnant woman on the street, and you want to be happy for them, but I would have to cross the street and look away because I could feel my eyes welling up. And it's and you don't want to be that way. And people would walk on eggshells around you, those that knew within your inner circle, but you don't want to be a part of a pity party, I know. But at the same time, it's tough. You want it so badly, right? So speaking of those interactions and those relationships, I'd love to focus on
what it does to the relationship with your partner. So you're with your partner, you're going through this thing which you just thought you were just going to have kids and it was going to be no big deal. Year 1 passes, year 2 passes, year 3 passes. What sort of an effect did it have on your marriage? How did you handle it? Did you talk about it ad nauseum? Did you not touch it at all?
Yeah.
How did you handle it with your husband?
So in the very beginning, we talked about it a lot because we thought this is the way to do it. But then when you hear no, 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 year after year after year, we took a few breaks in between, and then we just stopped talking.
Right.
And that's, I think, where the problem came in, because it's the elephant in the room. No matter what, you are both always looking at each other. And I always looked at him and I thought, I'm a failure. I'm failing him. I'm failing myself. I can't give him a child. I can't have a child myself. And so it puts a major strain and a major stress on your relationship, and in turn, all the relationships around you, you know, with family, with friends, because you're not yourself. And that's hard.
So for you, you see couples all the time coming in. What do you see in terms of the dynamic with relationships when they're dealing with this issue?
I see there's a very broad spectrum. There are couples who are very cohesive, who have spoken with each other about the situation a lot. And they are able to communicate both to me as their physician what their expectation, what they're anticipating, and they're very much on the same page. But by the same token, and this is everybody, I see single women, I see couples, I see heterosexual couples, I see gay and lesbian couples. It's always similar in as much as, are you coming with both understanding where you want to go? Do you want to do everything that you can do to get pregnant? Is one of you thinking of adoption and the other one thinking, why am I here? I don't want to be here. She made me come, or he made me come, or it's really his fault because his sperm is bad. 40% of the time it's male factor.
How do you identify that usually? Are there some couples that don't want to even go there?
It's not so much that they don't want to go there, but you know that you're treading on thin ice when you ask about something, because I approach it medically to begin, so you have to ask about the medical history, because it's a medical illness. People don't come and see me because they want to. They come and see me because they have to. And especially as we are getting older, as women, we have careers, we partner with people that we actually like. We don't just go out of high school and say, okay, let's have babies, when the evolution of our ovaries is programmed to have babies. 15 to 21, it's not practical, it's not 2016.
15 to 21, huh?
That's crazy.
Yeah.
If I had a baby when I was between 15 and 21,
I would have dropped
like,
it.
I think back to the girl I was back then.
I know.
But that is the prime optimum time.
Yeah, and
for your ovaries.
And we do so much talking about contraception, and I think that's why it's so important to have this forum on Cityline to talk about it, because as Infertility Awareness Week is here, people need to understand that contraception is important, but the idea of talking about your potential conception, what you as a couple want to do. Do you want to work?
And if it doesn't work.
And if it doesn't work, are you going to be okay with it?
Right.
And are you going to talk about it? Do you want to see a social worker? Because there are social workers that deal just with issues of fertility.
Okay.
And do you want to set limits for your family? Like, what are you going to say when someone says, are you trying? Because that triggers things. And really, people should never say that, just saying.
First of all, how many people say that all the time?
I know.
I mean, if you get down the aisle, and sometimes even when you don't, if you're in a relationship for a very long time, everyone's asking you, when are you going to have the kid? When are you having the kid? And then when you have the child, they're like, when's
When
the
it
number
has
two?
the number two.
Yeah, I've already got that.
It's a lot of pressure.
It's a lot of pressure.
Get out of people's business, would you?
Leave
them alone.
Leave them alone. But sometimes people say to me, we have an answer. So if someone says, so are you trying? You say, well, actually, it's none of your business. And sometimes people feel empowered to do that. And really, you have to decide as a couple what you feel comfortable saying.
I mean, I said, we've been working on it.
Right.
We've been working on it. And that was kind of our go-to answer, which we smiled a bit, but at the same time, no, we were working on it.
You were working on it. You were working on it hardcore. Oh my gosh, I'm so happy Josh is in the world now. This is so incredible. And all the advances that have come out of doctors like Dr. Marjorie Dixon that are making fertility possible for families who never thought they could go there. I mean, it's an amazing thing.